My topic is what are the effects of having OI type 1 on the patient, their lifestyle, and family as a child versus the effects on a child without this disorder? So, what is osteogenesis imperfecta? Osteogenesis imperfecta is an inherited disorder characterized by extreme fragility of the bones. OI is categorized into four subdivisions: type 1, type 2, type 3, and type 4. Type 1 osteogenesis imperfecta normally causes a larger number of fractures during youth than in adulthood. Hearing loss is developed and starts from the beginning of their youth. Type 2 osteogenesis imperfecta is the most uncommon and the most extreme. It delivers various deformations of the skeleton and is frequently lethal in early stages. The irregular collagen arrangement damages the lungs, causing critical breathing issues. Type 3 osteogenesis imperfecta produces evident skeletal distortions. Fractures before birth are normal, and it also harms the lungs and the muscles. Hearing loss also starts during youth and regularly becomes permanent by adolescence. Type 4 is more serious than type 1, yet less extreme than type 3. Fractures are generally common before puberty. Hearing loss also starts during the patient's youth. A few features on OI patients include free joints and muscle shortcomings, having a blue, purple, or gray color in the eye, having a triangular face, developing a spinal curvature, having fragile teeth, and having less than normal collagen structure. So, the reason I chose this topic was because my sister has OI type 1, so she is very lucky compared to those who have more severe cases. When she was born, she was very small and yellowish looking. My parents didn't realize she had this condition until a couple months down the line, where she had broken her leg as a newborn by taking her out of the car seat and her leg getting caught in the seatbelt. The doctors then informed them of her condition, and the signs of it were her grayish looking teeth, the way she walks, which is like a penguin, and her height. She is very short. As she got older, certain signs such as her height and the way she walks were more prominent, but at first glance you wouldn't know she had a condition. Throughout her lifetime, she has suffered multiple injuries and has gone to PT sessions to recover. I would go and help out the therapist with some exercises and really enjoyed it. From then on, I decided I wanted to work with children, but with more severe cases and mental disabilities, which then brought me to deciding that I wanted to become an occupational therapist in the future. I would like to know more about OI patients and how I can one day improve their lives in the future. With that, I have watched my sister struggle in her social life as a kid, being that she couldn't play in the playground or play any sports. So she felt like she couldn't be a kid and have fun, and this has impacted her greatly. I would like to gain more of an understanding on the effects of this and how it affects a child mentally and socially and how their outlook on life is. And although there are four subdivisions of OI, I chose type 1 because it's the mildest form, so it's easy and reasonable to compare their lifestyles and family to someone who does not have it. The previous research that has been conducted to help cure OI includes the NICHD researchers are exploring additional therapies for treating OI, including medications that build bone mass. One potential treatment, sclerostin antibody therapy, improved bone mass in mice. So historically, orthopedics used rods of a fixed length to help fractures heal and avoid or correct deformity. However, as the child grew, he or she was at risk for fracturing the leg immediately below the rod. Today, pediatric orthopedists at HSS are using the Fraser Duval telescopic intramedullary system, a relatively new form of instrumentation designed specifically for patients with OI who are still growing. Leon Root, attending orthopedic surgeon and former chief of pediatric orthopedics at HSS, as well as principal investigator in some of the first clinical studies of children with osteogenesis imperfecta, described some of the early breakthroughs in the field. Some of our initial attempts to strengthen the bone involved giving OI patients magnesium sulfate, which we thought might alter the action of an enzyme they produced that we thought to be part of the disease process. In doing so, we hope to change the course of the disease. So other trials from this era involved hormone therapy, steroids, and high doses of vitamin C and calcium. But unfortunately, none of these discoveries or trials worked to cure OI. And my hypothesis includes children with this disorder are very misunderstood because they don't like that they have a disorder and they don't struggle academically. So some people categorize them as normal even though they aren't. Therefore, I want to prove that a child growing up with OI type 1 struggles socially, emotionally, and physically and can develop depression and anxiety, as well as having a completely different lifestyle compared to those who do not have this disorder. And why is this study important? The study is important because there is currently no cure for this rare disorder. I emphasize rare because I would also like to bring awareness to OI, being that a lot of people don't know what it is. As I had said previously, people with this disorder are continuously misunderstood because they appear healthy, but they are very fragile. I would also like to bring awareness to the underlying effects this disorder has on a child and their lifestyle, as well as the effects it has on their families and in different types of settings.